All right, welcome everyone. I hope you can hear me. So thank you very much for joining us for our first alumni event. And I'm honored to have two alumni here with us, Eszter and Kata. But I also see that the third one here as a guest, Jana. He also graduated from our PhD program. So if he wants to join in and have some answers to our questions, Jana, feel more than free to also answer, of course, these questions. So just shortly about myself, and then I will, of course, hand over the word to our honored guests here, our graduated PhDs, Eszter and Kata. Myself, I'm Alexander Schwitzer-Wenning, originally from Germany, but for many years already in beautiful Hungary, Budapest. And I'm currently coordinating the third and fourth year of the Center for Translational Medicine. So as you can see here in the background, TM, Translational Medicine at Semmelweis University. And yes, I'm also in my last year of my PhD, hopefully graduating my PhD in October as well. So once again, thank you all for joining and a very heartfelt welcome. Now I would like to hand over the word to introduce yourself, Eszter and Kata.
Thank you. So welcome everyone. My name is Kata Illés and I've just graduated a month ago, so it's a really fresh experience. And I am also a third year otorhinolaryngology resident, and I started the program immediately with residency. And I am waiting for your questions.
Thank you. My name is Eszter Szalai. I am a dentist at the Restorative Dentistry and Endodontics Department and also SMS. And I am also a mother, so I started the PhD program when my child was 3 and 5. And last year I defended my PhD work, and today I am here too.
That's amazing. Congratulations for both of you, and also especially for Kata for the very recent graduation. Then I would like to jump in right away and ask a question to both Eszter and Kata. If you could shortly tell us, what do you think? What was the biggest advantage of joining this program? Particularly and generally, what was your advantage of doing a PhD, but particularly as well with the Center for Translational Medicine?
It has many advantages starting the program, and I am very glad that I was part of this. And it actually changed my way of thinking about studies and preparing studies. And the Translational Medicine Center give lots of things like support from senior students and statistical support as well, and it was really helpful to talk our project every week and even present, and it helped to have a different way to think about, as I mentioned, the scientific field, because previously I didn't know so many things, and like this program have a very good structure, and yeah, that's the main reason. And also if I need to just look up something on PubMed, it's also very useful to have this kind of knowledge accumulated in these years.
Kata, thank you very much for these words, and I'm very happy you mentioned this, since this is something I think we are all at the center very proud of, this especially very structured program that we do offer. Often, if you maybe have seen some introductory talks about CTM, we often compare it in a way of a tire change, the very classic way of a tire change, or a Formula One tire change. And with this structure, with the whole team, as you also mentioned, we very strongly believe that this is a huge support and advantage for the students to not be left alone. What we have experienced that in many other more traditional PhD programs, it is rather student and supervisor on their own, and often even the student completely by themselves. So here we really try, just as you said, to provide them with excellent senior methodological supervisors, like Eszter is one as well, to really have a broad help from every side. Thank you. Yes, absolutely. Eszter, what do you think? What was the biggest advantage of joining the program?
So I think if someone wants to work long-term in the Semmelweis University, they need a PhD. So this was my first motivation. But I think that the biggest advantage for me was that the program is really well organized and it helps you plan your day. So you can focus on your main work. And if you keep going and do your task, it's really increase your chance to getting a very fast PhD. Also, I met so many great students and supervisors like Kata and you, Alex, and from different fields, and it was very inspiring, the community. For example, with Kata and with you also, and with Jenner, we were in one class, and we saw each other in the progress report, and it was very inspiring, I think, when I saw Kata and Fanny and Jenner and you, that how they proceed and so on. So it was really great.
Great, thank you very much. And I can only give this back. It was indeed always a very great experience to see the others having their progress reports, presenting their excellence there, and especially you. I think, yeah, so you were one of the first two, right, to graduate from the CTM here. So congrats on this. Definitely the first one in the dentistry group. Really a great work. Amazing. For both of you as well, what do you think? In which way or how does the program influence your professional development?
Okay, I think I was lucky that to being the first student from my department to join the CTM program. And thanks to the SMS work, I got a lot of experience. And now my colleagues often come to me with questions, especially about methodology, which feels very great.
Yes, that's great. What do you think, Kata? How did this program, how did it influence your professional career or professional development?
So, as I mentioned previously, I see the scientific field a little bit differently now, and now I can make a difference between a good and maybe less appropriate studies. So I can pick things quickly from PubMed, which is very helpful to, if I don't know a subject area, I can just rapidly check the literature. And actually, when I started this program, I started with a really advanced topic like the middle ear surgery, which is not even familiar for all of the otolaryngologists. And now I think my knowledge increased very, so my knowledge is quite good in this area, and it's mainly because my supervisor had me a lot to study this and he given lots of speech about middle ear, and now I am fully prepared in this small topic. However, there is a huge things I still need to study, and without this program I would start my residency a little bit different, so from the beginning. But in my case, it was a little bit opposite side. So I started from the smaller part and make it more burden. However, I feel lucky because now I am feeling experienced in this small way, and but I have the knowledge how to look up the other parts of the field of otorhinolaryngology.
Great, thank you very much. Kata, when you just mentioned the middle ear surgery, some bell ring in my head. I think if I remember correctly, you did your first study on cholesteatoma and the reoccurrence of cholesteatoma. Maybe some of our guests here today have seen some introductory lecture from Peter, and I need to say that's a great experience every time, and I think you are mentioned there every time in the lecture, since also I really need to say one of the Kata's first project was not only published in the really best journal for ENT, the laryngoscope, but was also, but I think Kata can talk more about it, really quickly implemented in the clinic and had really within 1 or 2 years already success in the clinic. Can you tell us some about this?
Yeah, so it was a little bit different. We already established this technique. However, we wasn't quite sure if that's that effective. So we first looked the data and we looked our data. So we did meta-analysis and a systematic review, and it supported our idea about the mastoid obliteration technique. However, we have like 1 or 2 years established this technique in our hospital, and that 2 years just nearly enough to process this data, because we need longer follow-up time. But when we compare to the older statistics, it really helped us to see how effective this technique. And we have also another published study about that based on our data, and we have created the meta-analysis, and it seems it's a really good technique, and yeah, we are still using it, and it's strengthened our idea and our protocol in middle ear surgery. However, if we would find that this technique may be not so good, we actually would change our protocol, and we didn't use that technique. So it was like an important step in our practice, because we have to process our data and follow up the literature, which technique is the best and how to implement in our way. And this is also very important job for the Translational Medicine Center, because you are trying to get the scientific knowledge, the studies closer to the ward, to the patients, and implement it very, very quickly, as you previously mentioned.
Amazing. We are very proud at the center about your study and Eszter's, of course, as well. And I'm pretty sure many other hospitals, after they read your matter and see the results, potentially also have implemented this. Yes. All right. As a next question, pardon? Have you heard maybe about any other hospitals or units who have implemented this already, Kata?
InPage, they started earlier than us, so they are already using this technique. And I have some international examples. So I was in Austria in autumn when I was able to meet lots of otorhinolaryngology resident, and I know in Slovakia and in the Czech Republic they are also using this, and in Mexico as well. So that's very good. And actually this technique where my supervisor and when the clinical page studied or learned this technique is from the Netherlands. So there is a huge center there, and they are publishing lots of study, and our systematic review and meta-analysis also included their experience and their publications.
Amazing. That sounds really great. So you're probably already a small star in this field of ENT surgery. That's great. For both of you as well, what do you think? What was an unexpected but still valuable experience during the program?
Eszter?
I don't think that was something unexpected because we was the first year, so everything was a bit unexpected. But for me, the most difficult part was this presentation every week, and because I am not that type of person who really like this, but you know, today I am here, so maybe I improved a bit in this also.
Yes, for a newborn, everything is new and fresh, and yeah, it wasn't unexpected. However, it was a very fresh start that the lots of help that the translational medicine provide us, like the institutional support was very huge, and I really like that you are not alone, and it's kind of different from the other departments and PhD programs. But we know that from the beginning because it was a promise.
Great, thank you very much. Now, both of you, I think you're absolutely right. One time, the absolute teamwork, but also what Eszter said, I think, of course, next to the hard scientific knowledge and experience one gains within the CTM. One of the main advantages compared to other PhD programs, just as Eszter said, it is also a bit of a, let's say, daunting task or annoyance sometimes for the first year students. But in the end, this is one where profit most of, that every week they have to present in front of the group meeting, in front of vice rectors, deans, professors, a huge team of people, and stand in the front and do present what happened the last week and happened in the new week. I remember myself very well how nervous I was when I walked down the anatomy lecture hall every time, then speaking in front of our Dean of Dentistry, Professor Gerber, Vice Rector, Professor Hermann, and many other professors. But absolutely, for myself as well, as Eszter said, you really learn with your task and you learn with your challenges. And after a time, giving a little lecture, giving a group meeting or something really becomes much easier. So it's great to hear this from you as well, Eszter. And I really absolutely need to say Eszter is an amazing lecturer from us now as well, and a really great SMS, which has great presentation skills. One more question, absolutely. And I think after this, we also may open the questions for the audience. As a summarizing question, what advice would you give to those considering to apply for the CTM? Is there something concrete or something rather broad? Like, what advice would you give them?
Don't wait, just apply. So I think it's a great program, and if you want a really fast PhD, you can get it with this program. And this program gives you where you will learn a lot, grow as a person, and meet with amazing people. So you will also have the chance to push yourself and try new things. So I really suggest this program.
Thank you, Eszter. I can only support this. Don't wait.
So the first year is quite intense. So if someone applying this program, they need to know that they have to give time for themselves to make it through the first year. So you need to focus on that. And if you are participating 100% and you're trying to do your best in the first year, just it's easy. You can do it, the PhD under 2-3 years. However, it's not like the program in the other one. So in the first year, you have to be present. And after, maybe you can have time for other stuff in the hospital, in the clinic, or whatever you are doing. So you need to prepare that. In the first year, you just need to concentrate in this program.
You're absolutely right, Kata, with this. Maybe for the audience, since most probably not as familiar with the program, I'll give you a quick summary of how the program looked like, because Kata already started talking about the different years. So in general, the program is meant for 4 years, but as well as Eszter said, you can do it very quick. So there is a potential within 2 years and maybe 3 months, 2 months. So 2 years, 2-3 months, you could already graduate if you have your 2 publications ready. But how does this actually look like? In the first year, just as Kata said, it is more intense and time consuming. Absolutely not to be said that it can't be managed parallelly to your dental studies or your medical studies or pharmacological study or anything else. We have many great examples of this as well. MD PhD students and DMD PhD students who actually manage and handle both their medical or dental degrees the last 5th year or 6th year parallelly to their first year. But what does the first year actually look like? Every week, you would have one group meeting. This is the one I mentioned, walking down the anatomy stairs there, where everyone is present. So everyone from your team, I was also in the dental team. Every dental PhD student is there of the same year, plus their supervisors and the group leaders, other professors. This happens every week, and this is roughly 2 hours where you have to be present. Then there is also every week a project meeting, but this is only online, and this is a more private meeting with you, your clinical supervisor, and the methodological supervisor. The methodological supervisor is a senior PhD student who dedicated more time for research and to be more familiar and in-depth in the methodology of either meta-analysis, clinical trials, or anything. We have specific experts for all of these. And these are online. This is really for you to ask questions, to discuss your project, to go into the depths and really analyze everything and solve and answer all your questions you have there. This is on one side, group and project meetings. And then more or less every second week, there is also a seminar. The seminars are like class meetings. There are maybe some of you, when you're doing medicine right now, know these block courses. So this is just blocks. And then you have 8 hours of meta-analysis one week. Maybe 2 weeks later, you have 8 hours of some soft skill, maybe effective communication strategies, something like this. Maybe 2 weeks later, you have another block of 8 hours clinical trial. The great thing about this is that actually within the first year, you already have the complete ability to gather all the credit points you need to have your full PhD if you attend the classes. And also this can be managed with a medical study, since we offer each class 3 times per week. And you can, normally you should go to one of them and you are designated to one of the 3 days. But if there is a scheduling conflict and you can only attend another day, that's also no problem. And we do accept this since we are here for the students, of course. Yes, so basically this was so far the questions. I had a little explanation, but I think now we should open this discussion to the audience. And please feel free to ask any questions to Kata, to Eszter, or to me.
Yeah, so you did mention about the 2 years, 3 months, right?
Yes.
Is it applicable, like if you're applying for the conventional PhD, not like the MD PhD program, I can still, if
Absolutely.
I can finish it. Okay.
It's all upon you. Peter, the head of the department, always likes to say, you are the driver of the car. So if you put the foot on the pedal, you decide the speed, and you can make it within 2 years and a few months. So basically, because what needs to happen, you need to have your complex exam, and the complex exam will happen after 1 year and 10 months, roughly. And then 4 months after the complex exam, you can hand in your thesis. If you have 2 published papers in a minimum Q1 journal, so top 25%, you can hand in your thesis. And in October, after your complex exam, you can have the public defense of your PhD. So let's say you start in September 25, in October 27, the quickest you could defend.
Got it. Thank you.
Okay, I have a question. My name is Milad, and I have one question regarding the language certificate exam. So I was in English program in Pets University. So I finished my degree in English. So right now, I don't have any fresh language exam. Is it count as an equivalent language exam, as a degree as a language exam, or no?
You studied in English?
Yeah, I was in English program, and now I'm working.
That counts fully. All right. Are there any other questions? If not, then I thank you all, and especially Kata and Eszter, our esteemed guests, for their feedback and for their experiences during their PhD life and afterwards. So all the good what could happen when you do your PhD with us and after. So thank you very much, you two, for this. Thank you very much, Gianni, for organizing this event. And of course, thank you very much to all of in the audience for participating, listening, and asking your questions. We would be very happy to see as many of you as applicants within the next few months here and to conduct the interviews with you. If you have any questions, again, you can see the email address. Please feel free to write us. Thank you very much. I wish you all a great day ahead. Bye-bye.
Bye-bye.
Thank you, Alex. Thank you for your participation. Bye.
Thank you. Bye-bye.